Hey, everybody. I'm Dr. Seth, psychologist. I thought what I would do today is share something that I have heard a lot in my clinical work over the years with clients. Clients asking me this question: what does it look like if someone is a strong person? What does that truly mean? And of course, I bet you watching are smart enough and wise enough to know that strong in this sense and strong in life so often doesn't have anything at all to do with physical strength, but actually with emotional strength. Actually, having life skills and emotional resources that make you strong and able to weather all the different storms in a person's daily life. Because let's face it, life so often is not easy. So, when we take that question, what does it mean if somebody is a strong person? What is an emotionally strong person? I want to answer it from two different perspectives. The first is for someone who doesn't have a mental disorder of any kind, for someone who doesn't have any sort of diagnosable mental health disorder. For that individual, what emotional strength looks like is being able to manage a whole wide range of emotions and feelings and thoughts, being able to manage them in a balanced way. So when life throws curveballs or there is stress, someone who is not emotionally strong will have the propensity, will have the likelihood of feeling thrown, feeling flooded by that stress. And they will get overwhelmed, and then they will begin to resort in a number of unhealthy coping mechanisms to cope with it. So, an emotionally strong person without an underlying mental health disorder, they will be able to manage all of it and manage it fairly smoothly. They won't see some symptoms show up in any severe or chronic way in managing their life. Their sleep overall will be okay. Their eating overall will be okay. Their moods may change a little bit, but overall, they stay fairly consistent. They return quite easily to what we would call baseline. That is one example of what emotional strength can look like for somebody who doesn't have an underlying mental health disorder. Now, there is a whole other group of people that do have some type of mental disorder or some predisposition for underlying mental health issues. For example, a person who is prone to anxiety or person who is prone to depression. These are really difficult emotional struggles sometimes. And there's nothing wrong with the person who has that. It's certainly not anybody's fault. And what it is not is a sign of weakness. Research shows, for example, that there are brain based factors, factors that exist in a person's brain that can predispose them to certain mental disorders. So it's certainly not the fault of that individual. And so here's the thing: if you take somebody who has a mental health disorder or they have a predisposition to that, maybe they meet some symptoms of a particular disorder, let's say anxiety or depression. If you take that person and you add stress, they can have some very difficult days. It can feel very difficult and taxing, just overwhelming when someone feels flooded with anxiety symptoms or depression symptoms. And they may have difficulty coping well on a particular day or days because of it. But here's what's important to understand for those individuals who have some sort of mental health disorder, and for those who don't, to have empathy for them and really understand an individual who is dealing with mental health struggles. They may not appear to be strong on the surface because it may look as if they are overwhelmed with these symptoms. But you know what? Some of the strongest people I have ever known in my life and in my clinical work are people that are dealing with emotional issues, dealing with mental health disorders. You take a person who is really feeling extremely depressed on a particular day, and that individual is showing strength. They are strong to manage the intensity of those feelings, to try to exercise patience, to try to use all their thinking to remind them that this will pass, that they have been through this before. It can take a tremendous amount of work and strength for somebody dealing with mental health issues just to manage, just to try to be okay. So, although when we think about what is an emotionally strong person, we may not picture somebody who is struggling with a mental health disorder. It's important for everyone to understand actually just how much strength it can take to manage some of those intense symptoms. And then ultimately, here is the hope for anyone who does have a mental health disorder, that they reach a point where they are able and open enough asking for help and receiving help. And licensed mental health professionals, for example, are one of the most common places to start when asking for help. And research shows, for example, with so many mental health disorders, take anxiety and depression, for example, there is a combination of medication management and particular evidence based therapy practices like cognitive behavior therapy that can really help that individual manage that mental health disorder optimally in the best possible way. All right. I hope this helps. It's really important to remember there is not just one universal picture of what an emotionally strong person looks like. I'm Dr. Seth, psychologist.